Do you have shoulder pain? This could be the cause of it. I'm Dr. David Geier, orthopedic surgeon, sports medicine specialist, and anti-aging and regenerative medicine expert. I help you feel, look, and perform your best regardless of age or injury. Shoulder pain is a common problem. It can be caused by a variety of conditions. The most common cause is what's called impingement syndrome, which occurs when tendons of the rotator cuff get pinched under the acromion process. Other causes of shoulder pain include rotator cuff injuries, arthritis, bursitis, and joint instability due to ligament damage or dislocation. Some people experience symptoms that could indicate a labral tear or other conditions that affect what's called the glenohumeral joint, ball and socket of the shoulder. Shoulder pain can be caused by a variety of factors, underlying factors. Overuse, degeneration are common causes of shoulder pain in both young and old people. In addition to these factors, inflammation or impingement may cause shoulder pain as well. Injury to the rotator cuff muscles can occur during sporting activities like swimming and tennis and other overhead activities. The most common traumatic injuries are tears in tendons that attach muscles to bones in your shoulder joint. This type of injury often occurs during weightlifting exercises like bench presses or overhead presses due to strain placed on these tendons while lifting heavy objects overhead, or maybe in collision sports like football. Overtraining. Overuse injuries occur when you perform an activity repetitively without giving yourself enough time for rest between training. This often occurs in swimmers, baseball pitchers, and overhead athletes. Again, the most common cause of shoulder pain is impingement syndrome. Typically, you'll experience pain reaching overhead, such as reaching into a cabinet or combing your hair. You might experience pain reaching out away from your body, such as holding a carton of milk as you get it out of the refrigerator. You might notice pain reaching behind your back. Typically, with impingement of the shoulder and rotator cuff, you don't have the weakness of the shoulder and upper arm that you have when you have a tear of one of those rotator cuff tendons. Now, rotator cuff injuries or rotator cuff tears are common in overhead athletes and middle-aged and older adults who have jobs that require repetitive motions. The rotator cuff is a group of muscles and tendons that help stabilize the shoulder joint. It's basically a combination of four muscles: the supraspinatus, infraspinatus, teres minor, and subscapularis. These muscles work together to allow your arm to rotate and move in different directions. You might notice weakness in addition to pain when you try to do overhead activities. Arthritis is another potential cause of shoulder pain due to inflammation in the joint. Arthritis can be caused by wear and tear, or it can be caused by an injury. It can also develop over time as you get older. If you have arthritis, your body will have trouble moving fluidly, through motion, and then that joint becomes stiff and swollen. If this happens in your shoulder, it may actually feel like there's something stuck under your arm in front of your chest when you move around. If you're experiencing any discomfort in your shoulder, it's important to see a doctor or an orthopedic surgeon so that doctor can try to figure out what's going on through physical exam, x-rays, maybe even an MRI. The doctor then can provide treatment options that will help you relieve your symptoms as quickly as possible. Now, I'd love to hear your experience with your shoulder injury. Leave those in the comments below. Just know that if you leave a question in the comments, I can't offer you medical advice, but I could answer your question in a future video. Also, make sure to subscribe to my channel and ring the bell to be notified when I release a new video and when I start my next live stream, including my Ask Dr. Geier live shows. Thank you so much for watching. I look forward to helping you feel, look, and perform better than ever.